One to our special city commission meeting to begin the second half of this year, hopefully with a new beginning for all of us. I've asked for us to hold this meeting at this time for various reasons, but we'll start with a call to order.
Thank you.
And
Mayor
roll call.
Brooke?
Thank you. Here.
Thank you. Vice Mayor Carter?
Present.
Commissioner Sarah? Not presently here. Commissioner Vignola?
Here.
Thank you. Commissioner Simmons?
Here.
City Manager Babinick?
Here.
City Attorney Hearn?
Here.
Thank you.
Great, thank you. We'll go forward with our Pledge of Allegiance at this time. Our city manager, Frank, if you'd be kind enough to lead us, I'd appreciate it.
Pledge allegiance to the flag of
Flag.
the United States of
United States
America
of America.
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And if you'll all please join me in a moment of silence. Thank you very much. JJ, if you would please share the virtual meeting statement.
Thank you, Mayor. Due to the ongoing state of emergency as a result of the novel coronavirus disease, this public meeting is being held using communications media technology in accordance with Resolution 2020-16 of the City Commission of the City of Coral Springs. And the city has taken several measures to ensure the requirements of 120.54 Florida statutes, as well as the spirit of the Florida Sunshine Law, is complied with during this time. Accordingly, this meeting is available for viewing live on City TV, Blue Stream channels 725, 25, and 25.7, and ATTU verse channel 99, online at coralsprings.org/citytv, and can be heard live on City Radio 1670 AM. For those individuals who may not have access to any of those means, the city is providing access to view the meeting on City TV outside the Coral Springs Municipal Complex by the garage. If you plan to attend, please practice social distancing, wear your mask, and do not stand closer than 6 feet from anyone else there. Public comment will be received by phone and email today. The local call number is 954-344-5900. If you want to submit a written public comment, you complete the form located at coralsprings.org/public comment. For those attending physical live stream at City Hall, a method for public comment is available, and a city staff member will assist you if you wish to participate. That's it for the special meeting virtual, Mr. Mayor.
Great, thank you, JJ.
Thank you.
So to explain for everybody why I've asked for this emergency meeting, there's been quite an increase in the numbers recently, and the reaction from so many citizens kind of go from this range over to here. And I hear about issues about not wearing masks and not social distancing properly. And then you also hear many questions, are the numbers real? And another question that's been asked repeatedly is, what is the recovery rate? So I've asked for this special meeting in lieu of what we normally have at this time. The commission would be on a COVID briefing every Monday, Wednesday, and Friday. These days, we're on a COVID briefing, usually from 11 to 11:30. So I'm hopeful to hear from citizens, share with the citizens' concerns, focus on solutions, focus on unity for our community, and get and share as many answers and solutions as we can and what the realities are here in our city. So before we take public comment, Frank, can you share with us or have staff share with us about the numbers here in Coral Springs in particular, and where we were relative to the beginning of this pandemic, and where we are now?
Sure, Mayor. As you said, the state has seen an increase in cases for COVID-19. So we're going to look at the last 14 days worth of data. And what I can tell you is all the data I'm going to share with you exceeds the numbers that we were at during the height of this previously. We're still in the first wave of this pandemic. We haven't surpassed, we haven't been out of the first wave. So this isn't a second wave or anything like that. This is more of a reemergence during the first wave. As far as our information goes, the information that we monitor is from the Florida Department of Health primarily. However, we do talk with our local hospitals, districts, and we also look at the CDC, and we also look at the numbers that are coming out of our computer-aided dispatch system through our dispatch center for local call data. So in the last 14 days, we have seen an increase. Right now, the state's reporting a little over 152,000 cases statewide. It's important to remember that these numbers are totals from the beginning of the event, and not current. One of the things that you talked about is recovery rate. We don't have a recovery rate. Recovery rate is not something that is reported by the Department of Health. So if somebody were to ask what our recovery rate is, I cannot with any kind of certainty answer that question because that information is not currently available through the Department of Health. Statewide, 14 days ago, we were averaging about 3,300 cases per day. Over the last 7 days, we've been averaging about 6,900 cases per day. And as you can see, that's a doubling in 14 days. So one of the things we look at is, we don't just look at the numbers, we look at trends, and the trends are more important than the actual daily numbers. So when we start to see doublings in less than a 20-day period, that really starts to become concerning. And that's kind of where we are right now is a 20-day doubling. The median age for the state ranged in the last 14 days anywhere from 33 years old to 37 years old. As of yesterday, it was 37 years old was the median age. Now, that's important because back in April, the median age was much higher. So there's a much younger group of folks that are testing positive for coronavirus at this point in time. And I'm sure as Jarrett will talk about when he gets to it, the younger population is more resilient to the virus than older population may be. In the last 14 days, the number of people tested in the state have ranged anywhere from 25,000 a day to 78,000 per day. And the percentage positive has ranged anywhere from 7.7% to 15.8% over the last 2 weeks. So what does that mean is anybody who's been tested, anywhere from 7.7% to 15.8% of them have come back positive. As of yesterday, the percentage returning was 14.5%. If you remember, you heard a lot about the 10% number being kind of the line, if you will, that we wanted to stay below 10% of those returning positive. And this is one of those cumulative numbers we look at rather than looking at how many daily cases are coming back. We're looking at the percentage of those coming back testing positive because to me, that's more relevant than a whole number. Broward County currently has 15,600 cases. The county's seen an increase in number as well over the last 14 days. 14 days ago, we were seeing an average of 320 cases per day. And over the last 7 days, we've seen an average of 551 cases. So we're about at that 20-day doubling for the county as well with numbers. The median age for the county is pretty consistent with the state, anywhere from in the last 14 days, 32 years old to 37 years old. Yesterday, that was 36 years old was the median age for the county. Again, that younger population, and I know Dr. Lai is on as well, and he may talk about the resiliency of that population as compared to a little bit older. It seems that the younger, we are, the more we can kind of fight off this disease and the less effects it may have on us. And there's always caveats to that. That's not a blanket statement. Over the last 7 days, we've seen about 6,900 cases per day on average in Broward County, and that's ranged anywhere from 2,800 to I'm sorry, that 280 to 690. And that's anywhere from a 6.1% to a 13.6% return. So anywhere from 6.1% of those tested were coming back positive compared to the 13.6% at the high end. The number of folks being tested per day was anywhere from 2,800 to 6,900 in Broward County. So the numbers of those being tested are going or range anywhere from up to 2,800 people. I'm sorry, up to 6,900 people per day. Coral Springs, we currently have to date 635 cases. Again, that's to date. That doesn't mean there's currently 635 people that are active. We do not have a recovery rate. Therefore, we don't know how many active cases we have, but we do know that to date there's been 635 cases. I want to just go back and correct something I said. For Broward County, we're averaging 323 cases per day 14 days ago. In the past 7 days, we've averaged 551 cases. I confused the number of cases as compared to the testing, so I just wanted to clarify that.
Frank, can you say that comparison just one more time, please?
Yes. So last 14 days ago, we're averaging 323 new cases per day. Over the past 7 days, we've averaged 551 cases per day. In the last 14 days, we've tested anywhere from 2,800 people per day to 6,900 people per day. And we've got a positive rate of return anywhere from 6.1% to 13.6% over the past 2 weeks. Yesterday was the 13.6%. So that was on the higher end yesterday of that positive rate of return. And our goal remains the same, Mayor, to ensure the safety, health, and well-being of our residents and our employees, our community as a whole. I know that Jarrett and Dr. Lyle will talk a little bit about the hospitalizations, both in Broward County and regionally, so I'll leave that for them. Again, the recovery rates tend to still have, are challenging because we're not getting them. And also the specific number of deaths related to Coral Springs is something that we don't have an exact number for. Because that's something that's not reported back to us either. I'm going to just go.
Frank, I'm going to allow Commissioner Vignola to interject, and then I've got a question or two. Commissioner Vignola, go right ahead.
Frank, the state reported yesterday's numbers a little bit ago, and yesterday was 14.8%, which was obviously today. I know when you're referencing yesterday's numbers, that's what was reported the day before, but today they reported 14.8% in Broward County.
Yeah, unfortunately, right before this meeting, the state's website was was not up. So you must be looking at the. Actually, I just went on; it's still not showing me yesterday's data. So, so you're saying yesterday in Broward County they're showing 14.8%.
14.8% with 536 positives. I'll send that.
Well, I'm sure they'll update it.
Thank you, Commissioner. So, Frank, I just wanted to interject for a moment. When I was on the mayor's call last week, I couldn't make the mayor's call yesterday or the day before because of my work obligation as a lawyer. But when I was on the call last week, I specifically asked a Department of Health official about the recovery rate and, how can it be measured? And what she told me was you can assume that if the person hasn't died, they've recovered. And that might be one way of estimating non-scientifically the recovery rate. So my suggestion would be to get some kind of estimate. My suggestion is better than no estimate at all for a couple of reasons. One is, there's often so much focus on the negative aspect of COVID, and there are many, but you don't want to have people be hopeless if, God forbid, they get it. And to somehow maybe lobby that measurement, if there's any way we can, I think would be helpful. Obviously, if you have people that have been infected maybe the last 14 or 21 days, you can't say that they've, quote unquote, recovered. But is there some way to dig more into the numbers, Frank? Is there some way to apply pressure to the Department of Health to begin to measure that? Or is it just immeasurable and we have to live with yet another uncertainty?
So, Mayor, using that methodology, it's about a 99% recovery rate, actually a little bit more than a 99% recovery rate using that methodology. So if we just took the whole number of cases and you know, we took the number of deaths and divided it by the whole number of cases, you're at probably a 99.4% recovery rate
Well, I
in Coral
appreciate you-
Springs.
In Coral Springs.
And that is, and I want to put a caveat to that. That is not a official number. That is what we know as today of the numbers of deaths that we think happened in Coral Springs as related to it. So you'd be at about a 99.4% recovery rate.
Mayor,
Gotcha. Yes,
the
Commissioner.
as being reported as of today is 2% of all cases. 13% of all cases result in hospitalizations.
Can you say that one more time, Commissioner?
2% of Broward residents that's the death rate in Broward County according to the state of Florida, and hospitalizations are 13% of all cases.
Thank you. So, you know, I'll share, because I'm also a numbers guy. You know, a lot of our citizens are looking to numbers, or they're avoiding numbers, or they're not believing numbers. I think having some numbers is more helpful than having, you know, none. Obviously, I have, you know, great faith in our city management and what you're doing, Frank, to give us the stats that you're sharing with us in our city. And again, my main purpose for today's meeting is not about scaring people. It's about sharing with people, you know, as much as we can, and continuing to focus on solutions and the public safety of our citizens. So Frank, do you have any other numbers you want to share now, or shall we go to Dr. Lai and Jarrett?
You can go to Dr. Lai and Jarrett, Mayor.
Great. Dr. Lai, would you like to go first? And thank you for being here.
Hi, Mayor. Hi, everyone. Yes, sure, I can go ahead. But just to kind of add on to your numbers, I remember our intensivist group, the CEO, they have contracts throughout the country. And what he mentioned was like the intubated mortality rate for COVID-19 patients in the Northeast US was close to about 80%. And then he said for our rate at Coral Springs was 18%. So it was a pretty significant, less number. And he said it was a great collaboration between the ED, anesthesia, and the ICU units. You know, granted, we weren't overwhelmed as much as they were in the Northeast, but those are some numbers that were interesting to hear for us compared to them, mortality rate wise. Just how the treatment is ever changing, and we're seeing stuff come out in the past month. You know, how the FDA on June 15th released a letter kind of revoking the emergency use authorization for hydroxychloroquine and chloroquine. A lot of that has been kind of debunked, and they're not really seeing too much of a role of it in acute treatment. There's studies talking about dexamethasone steroid use in the sickest of the sickest, like those requiring oxygen supplementation or those needing to be intubated, has shown to be some improvement. They noticed some mortality benefit in those giving dexamethasone either orally or IV every 6 hours for 10 days. And talking about, the convalescent plasma, there was the article in JAMA, June 3rd, and it was, studies in China, 7 medical centers there. The numbers, they're trying to reach about 200 patients goal in the studies, but they're only able to get in the 50s, probably because they kind of knocked the numbers down so much. But they saw some benefit of improvement in about 2.5 days, quicker recovery in those that received the plasma. There's some trials going on now using colchicine, and that's in Greece. They're doing a lot of looking into that. Results kind of pending. And then they talked about the vaccinations, where we are with the vaccinations. So apparently there's 3 main ones funded by the U.S. government, and they are moving into phase 3 trials now. So there's one called Moderna, aiming for July of this year. August, there's a spike protein that's being done by University of Oxford. And then there's the BNT 162 that's also for September. So there's 3 vaccinations kind of all in the works, but how effective will they be? Remains to be seen. Our volumes, in the ED have been increasing. I'll probably maybe leave that up to Jared, but basically we've been seeing the uptick in the COVID patients. But yes, they seem to be right now, most of them for the most part, a little bit less sick than they were back in, March times or so. Haven't seen many intubated at all, and definitely younger population seems to be affected more so. But still, we're getting some of those, in the 80s and up, still testing positive.
Dr. Lai, what are the symptoms of the younger population that are coming in, and how quickly are they getting out?
Some of them, again, most of them are the most common kind of like, body aches, fever, chills, cough. A lot of them do report that lack of, the loss of taste and smell. They're saying that might be actually one of the earlier symptoms that patients may encounter. So that, as well as even some that are asymptomatic when it comes to viral symptoms, we have come across, cases where patients are admitted for something else, but because we test every admitted patient for COVID, some are coming back positive. And, I believe the, turnaround time or recovery rates are, I don't have the exact numbers on those. For some time being, we were transferring our patients to Broward Health Medical Center when they were doing a centralized COVID unit there. But I'll let Jared kind of speak more to that.
Sure. Does any of the commission have any questions for Dr. Lai? Okay. So Jared, thank you very much, doctor. We really appreciate you being here and what you're doing for us. Thank you.
Thank you.
Jared, welcome to the call.
Thank you. Thank you, Mayor, Commissioners, City, Mass Police, and the emergency management folks. We really appreciate everything you are doing to keep our city and hospitals safe. I apologize, I don't have video here. For some reason, I'm having a technical difficulty, but that's probably a good thing for everybody. So as Dr. Lai had mentioned, from an outcome perspective, we've seen very good patient outcomes. We're taking every precaution possible. Our team of physicians, our nurses, our front line, they're working very hard. In time, we've really seen an enhancement when it comes to the clinical protocols, the medications, the care plans, the access to trials and whatnot has really been, really phenomenal. And so we're very fortunate here to have such an incredible group of doctors and specialists working around the clock to make sure that we have excellent outcomes. But I guess just getting back to the city manager's, Frank's comments earlier, we are truly seeing a younger age population. We are also seeing an increase in total hospitalizations, particularly, in Miami-Dade, south part of the county. And it's also here kind of, in the northern part of the county where the numbers on the hospital side are picking up. But we are prepared. We have capacity. We have ICU capacity. We have medical surge capacity. And as we've done before, we have prepared ourselves for any potential surges that could potentially come our way. From a day-to-day perspective, we are doing elective surgery in the hospital. Around the hospital, we have enhanced all the infection control measures, whether it's in waiting rooms or people that are coming into the hospital with a process that we have. There, all of our entrances and everything have additional cleaning and whatnot. We have limited our visitor policy a little bit further. So a visitor on the inpatient side is allowed, one visitor per day, and there's basically a time slot that's there. And that's something that we're tweaking as we're watching these numbers, because we want to make sure that everybody is safe. But again, we're ready. And we're also freed up a fair amount of ICU beds and medical surge beds. And we do have the PPE. That was a struggle in the beginning when we all got started across the country. But we have PPE, and we have the N95 masks and gowns and gloves and you name it. And that's a big piece for our caregivers here. But a special thank you to all of you and the community, and happy to answer any questions that you have.
Great. Thank you very much, Jared. We appreciate it. Anybody, any questions for Jared?
I don't have a question, just a statement.
Sure, go ahead, Commissioner Simmons, and then Commissioner Vignola.
Jared Smith and all of Broward Health Coral Springs, I just want to say thank you. My newborn baby girl, Callie Blake Simmons, was born at Broward Health Coral Springs, and your staff was wonderful, and just the experience there was just really great. I'm sure you hear her in the background now. She's getting a bath with her mom. But it was just a wonderful experience, and I can't stop gushing about how well we were treated there, and the care and attention and the just everyone. So I just wanted to say just a general thank you and put that on record since this is a recorded meeting. And yeah, seriously, thank you.
Well, thank you and congratulations. We appreciate your kind remarks and enjoy every single moment. From the pictures and what I've seen, she's absolutely beautiful.
Duly noted, Commissioner Simmons, and that's awesome. That's awesome. Commissioner Vignola?
Jared, I just want to, I know there's been lots of reports of people not going to the hospitals when they should now. People are scared that they're going to be around people who are COVID positive. If you can just share with our residents precautions you guys are taking to make sure that COVID patients are separated from, that it is okay if there is an emergency, it is safe. We do still want you to go to the hospital.
Yeah, no, 100%. I think people need to recognize that this is what we do. We are very well trained. We have excellent caregivers and clinicians, and no different than, the city and EMS. We follow very strict protocols here. So from a standpoint, it is a very safe environment. So first and foremost, we would cohort any patient that is presumed positive. Those patients are in a private room where we've enhanced, let's say, the air pressure. So we have negative pressure rooms and the airflow to protect not only the patients and the staff and everybody. That airflow goes directly outside the hospital, so it doesn't circulate within the hospital. So we've taken every single measure to keep people safe. In every area, all the clinicians are well trained when it comes to donning and doffing the PPE and the measures that we take on every single case. It's every patient is every time we're flying a plane. It's no different than that. So from a patient standpoint, you need to feel safe coming to the hospital. If you don't, call my office because we're taking every single precaution. We test every patient that gets admitted to the hospital to confirm whether or not that they are COVID positive, so that we can tailor treatment accordingly. We test every single patient that's coming for surgery, and we test many of the outpatient areas as well. So we're very actively in testing. So we know what we have at any given point in time. From a care perspective, we follow strict infection control measures throughout. We have epidemiologists, experts that are monitoring everything we do. We track and trend it. So I feel very safe here. And I share with you, I don't feel safe here because I'm the CEO of this hospital. I feel safe here because of the team and everything that this team is doing each and every day. What we are seeing, though, across the country and locally is people are not going to their doctors. They're not necessarily following all their doctor's recommendations for advanced testing. So patients could not do well on a stress test and prefer to hold off on a diagnostic or an interventional cardiac cath and want to postpone those type of procedures and diagnostics. And unfortunately, that's just, quite frankly, a bad decision. You need to follow and get your care. I can't emphasize that enough. The doctor's offices are doing many of their appointments virtually. They're following very strict guidelines as well. But you have to follow your care. You can't stop. COVID didn't stop heart disease. It didn't stop GI issues. So I encourage everybody in the community to get the appropriate care. It is a very safe environment. We are watching very closely everything that we do. We've seen where the emergency room visits are down. And frankly, that really is a concern because we understand patients are not coming to the hospital. I've had friends call me up and their doctors, anecdotal conversation for a second, but their doctor recommended that they needed to come to the hospital and see a GI specialist, and they were concerned if it was safe or not. Here you have a doctor telling you need to go to the hospital. It's time to go to the hospital, so you got to take proper precautions. So anything we can do, anybody has any issues, concerns, call my office, and we'll help guide you through the process.
Thank you.
Thank you very much, Jared, and thanks for asking that question, Commissioner. Vice Mayor, any questions for anybody, including Alex Falcone?
No, I think everything's been covered really well. Thank you.
Awesome. Sean? Great. Thank you. So I've got two questions. So I sent you what somebody shared with me before about the death rate decreasing. Frank, I don't know if you have any more information about what I had shared with you.
Well, the death rate, I mean, if you look at the national statistics, the death rate has decreased since the height of the disease. The death rate, hang on one second, I have it here. So the daily death rate at one point was at, there's 2,200 folks a day nationwide. And as of today, it's 620 per day. So there has been a significant decrease in the death rate. And looking at some of the projections, that trend is projected to continue out pretty consistently throughout the end of July. So yes, there has been a decrease in the death rate.
Great, thank you. So also, one of the common concerns, is there any way to get access to testing that gives us quicker results on a broad basis? I know we've done that at the city. Is there any way to get greater access to faster result testing?
I will bring Alex up to talk about testing. He's spearheading that for the city. So Alex, can you address that, please?
Yeah, absolutely, Frank. Mr. Mayor, excellent question. We've been working diligently to try to improve the rate in which we get results. Unfortunately, at this time, there's supply shortages. The manufacturer, I know Abbott is one of the major manufacturers that supplies these PCR tests. There's some supply shortages on the reagent side. And so we've been working with our contacts to improve, how many cases we have. So another issue that we're dealing with on the testing front is we've actually increased the capacity of testing at Mullins Hall. So we were, put it in perspective, in the month of May, we were testing an average of 150 to 160 people per day. That's increased to roughly, this past week, we were averaging 500 people per day, anywhere from 400 to 550 per day, getting tests at Mullins Hall. So as those testing numbers increase, the labs have to deal with more tests, and in turn, the result in those test results do, slow down. We are working with a couple of private labs to offer testing directly to residents with a faster turnaround time. We're aiming for 48 hours or less, and that will be rolled out first to vulnerable population. So we'll first look at assisting folks who are either residents in assisted living facilities, nursing homes, or are employed in assisted living facilities, nursing homes, and other medical professions. Once we get a decent supply chain set up, we're looking to expand that as much as possible. There are also other private options available to citizens. So, for example, citizens who do have health insurance, they can go to major clinics, MD Now, or other providers and get testing results back quickly. If you don't have health insurance, there are a number of clinics that are billing directly to Medicaid or Medicare through the CARES Act, so your test is still free to you. We are also happy to announce we're partnering with OneBlood to offer a free antibody testing blood drive at the Old City Hall site, which is scheduled to take place on July 17th. So we're looking to expand that out as well as another free testing option. So to answer your question, Mr. Mayor, yes, the testing results are not coming in as quickly as we would like, but we're working through a myriad of different avenues to improve that testing capability.
Thank you, Alex. And maybe you can also answer, where are we, at least here in Broward, with contact tracing, what's being done and what can be done?
Yeah, another great question. Contact tracing for the members of the public focuses upon, looking at someone who's confirmed positive for COVID and actually going back and seeing who they came in contact with. That helps us to identify other individuals who may potentially be exposed to this virus. Contact tracing in Broward County is handled by the Florida Department of Health, and as well as some private healthcare providers. On the city end, we do not have access to the personal data that would be needed in order for us to effectively contact trace. So for example, if somebody tests positive at the Mullins testing site, as a city, we don't have access to their name, we don't have access to their information, and so there's no way for us to perform contact tracing. The Department of Health, however, does have access to that information. And as part of that testing process, they follow up with those patients and they contact trace to see who else may be exposed. I've read an article. I know that Mayor Holness announced that Broward County, through the CARES Act funding, was funding additional contact tracers that would be employed by the Florida Department of Health. And so that effort in Broward County is expanding. Our best bet is to put the contact tracing in the Florida Department of Health, because as I mentioned, they're the entity that has access to the necessary information.
Frank, at our next regular city commission meeting, could we invite a Department of Health official to come share with us information?
We can extend the invitation.
Okay, great. Thank you very much, Alex. So at this time, I'm going to go to anyone that might be waiting to be heard for public comment. Deborah, do we have anybody that is signed or waiting to be heard?
No, we do not. I'll double check with Robert. No, we do not, sir.
Okay, wonderful, wonderful. Anybody on the commission have any comments or questions or concerns you'd like to share?
Mr. Mayor, I'll just add that these wait periods are unbelievable. My daughter went down to CB Smith Park to be tested. When she finally reached the policeman who was directing traffic, she said, "So from this point, how long do I have before I get to the front of the line?" He said 4.5 to 5 hours.
Wow, at CB Smith. So do you know, Alex, what the wait is here? Apparently now they're not able to make an appointment at Mullins, but they can drive up or walk up. When they're doing so, what is the wait for the citizens that are coming to Mullins?
Yeah, I was out there yesterday. It obviously depends upon the time of day that you arrive. Our wait was, I'd say, under an hour from the start of the line to actually getting your test. Beginning next week, we're actually going to implement a wait, basically a text app. So when folks come up to get tested, they'll check in. Their phone number will be put in the database, and they will receive a text message when it's their turn to take their test. So what that allows them to do is wait in their vehicle. They can fill out their forms and sit in the air condition of their vehicle as they wait for that. If an individual does walk up, we have put out extra tents and they can wait in that process. So it will help to hopefully stem the line and enable people to kind of take some time away, and they'll get a text when it's time for them to come back. So it's the same technology that we're using when you go to a restaurant or something similar and you're placed on a wait list.
Great. When I close out, I'm going to reiterate how important it is to wear face masks. Frank or Alex, can you share with our citizens exactly what we're requiring and what penalties might be for not following the procedures?
Yeah, I'll actually ask John to weigh in on this as an interpretation of the county order, but there is a county order in place currently that requires facial coverings whenever you're in public, and there are a couple exceptions to that, and having to do with medical, having to do with if you're out doing exercise and stuff. But I would ask John to kind of weigh in on that if you could, John.
Great.
John, you're on mute.
John.
Sorry about that. Thank you, Frank and Mayor. We are following the county rules, as Frank said, on the wearing of face mask. It is required in any businesses, inside basically any retail, any service industry. There are penalties to be fined, to be removed, if in fact you refuse to be removed, up to and including being arrested. The only time that you're not required to have a face mask is when you are outside, or in a private type facility or house, in a swimming pool, it's usually, especially in Florida, is outside. So face masks are not allowed indoor and enclosed spaces. And we are enforcing the county code. We are code enforcement's out there every day. And we had conversations as recently as this morning, reiterating how important that is because, and Frank, you have the information on when people are wearing face masks and maintaining that social distance. It is a great preventer of the spread of this disease. So so we're fully engaged with the county. We have an agreement with the county to enforce it. We are talking with the county about even different ways to do that as we move forward. So we understand the position of this city is how important that is.
Thank you. Frank, go ahead, Vice Mayor.
I was on a call on Friday with the Florida League of Cities, and there was a doctor on there, and he said that the mask wearing reduces your risk by 80%. I mean, I knew it reduced it. I just didn't realize it was 80%. So I thought that was good information.
Great. And Commissioner Simmons, I know I don't see you, but anything you want to share or question?
No, not what we're doing. Everyone's covering all of that. I have a bit of extra business, I guess, outside of what we're talking about today. So I'll wait to bring that up. Or is that where we're at now? I don't know.
Not quite there yet. Not quite there yet. But I'll make sure I come back to you. Frank, can you share with everybody, please, or have Christy share what we're doing for and with our business owners in town and some of the successes we've had with assisting them?
Mr. Mayor,
Yes.
before we go to that, can I just go back to the mask wearing?
By all means, by all means. And
And
then go to Commissioner Vignola. Yeah, if I see you, I can see your hand waving a lot easier. So Commissioner Vignola, you are the best at that.
okay, thank you. First, I want to thank Communications and Marketing doing a great job in educating our residents on the necessary steps to stay safe with the social distancing and washing hands and mask wearing. I just want to kind of go back to the mask wearing. We all know that this is a very important step. And I just want to remind the commission and city staff, we all get caught up, and then I even got caught up in a minute yesterday where I had a mask on, took it off, and I was around people. But we definitely need to model this. It's critical, especially if we're posting anything to social media. People are looking for our leadership, and we are doing a great job. It's obvious with our medical professionals who are on the call, giving us the updates and support. But we are leading the way, and we need to, walk the walk and talk the talk. So I just wanted to put that out there just as a reminder, not only for our staff, but also for our commission. Thank you.
Great, thank you. Commissioner Vignola.
Yeah, just talking about the masks and things, and I think everybody knows I spend a lot of time at the parks and stuff, and see a lot of parents gathering up near each other, not wearing masks, and the thought of, hey, well, this person's careful, that person's careful. If you both don't have masks on and you're near each other, you're not careful, they're not careful. It doesn't matter what you look like. If someone, you think they're a good person or whatever, this is not that type of disease. This is something that anybody can catch, and I just want to reiterate that to our residents that, look, even if you're outside or whatever, if you're near somebody, wear a mask. And when you're indoors, wearing a mask to here doesn't help. I think that's the silliest thing ever, is wearing a mask to there. Cover your nose, cover your mouth, and it's a courteous thing to other people. I've gotten to the point now where if someone comes near me and they don't have a mask, I say, hey, excuse me, can you put your mask on? And I think that's important too. And then as far as I heard, I forget, I think it was the mayor talking about exercising and things. Some of the sports companies now are coming out with cool masks specifically for sports. I know I saw a report on Good Morning America last week that Under Armour brought theirs to market already, and I believe some of the other manufacturers are going ahead and doing that. So something to take a look out there for those of our residents that do like to exercise but want the safety of a mask. It's probably a good practice to go ahead and look at those types of products. So,
Great, good comments, commissioners. Back to you, Frank.
I will ask Lynn to kind of give us the overview, and then Christy to touch on some of the particular items. Lynn, can you just give us the overview on what we've done for a local business and where we are? And then Christy and Catherine, if you want to fill in any blanks, please do.
Sure. Thank you, City Manager, Mayor, Commission. As you know, once this pandemic had hit, we immediately opened our business hotline to assist businesses in navigating the emergency orders. As you all know, they've changed multiple times. So we were constantly in communication with our local businesses to try to decipher what the orders meant for their particular business. Our code compliance staff has tripled their efforts in responding to non-compliant reports. They keep emphasizing and educating our businesses about protective measures. They've been doing a phenomenal job. So much has really landed on code enforcement and, of course, our police department, but really to educate our businesses. And for the most part, we're very fortunate because our businesses have been primarily compliant. We provided those opening packages, and you may remember this. We talked about it at previous commission meetings. They included masks, instructional guides, and hand sanitizer, thanks to Jared and his team, so that businesses, once phase one had finally hit, businesses could safely reopen. And Christy and her team did a tremendous job fielding all those requests. Our code enforcement did a tremendous job in distributing that to local businesses. We created the Connecting Businesses with Grants and Loans program. We've helped local business obtain over $1 million in grants and loans. I think it's more like 1.3 million at this point. Thanks to Catherine and her team, her grants team. Think about small businesses just did not have the know-how to fill out all of the CARES paperwork or to identify other grants that were available. And we were really fortunate to be able to provide that service to our business community. We launched the Coral Springs Back in Business program, providing small businesses with $1,000 grants. All they had to do is have certain requirements, over 3 employees, less than 50. And as long as they turned in all their paperwork, they received $1,000 to assist with the PPE purchases they needed to safely open. I think Christy's last report was she has issued 222 of those checks to local businesses. And we will be highlighting that, as a matter of fact. We'll be visiting different businesses and taking some photos safely with masks and highlighting what we did to assist those local businesses. And then most importantly, and Mayor, you're part of it, the Economic Recovery Task Force. We were able to obtain input from all facets of industry to really get a better understanding of what our business community was dealing with as a result of the COVID-19 crisis. I know you sit on the Recovery Task Force, and a lot of recommendations came out of that. So that was one other area that we were helping businesses. And then along with the chamber and Cindy Brief, we were hosting webinars and virtual meetings to ensure our business community was well informed. We even had Frank, our city manager, participate to really give comprehensive updates to the business community and really reaffirm our commitment to helping them recover as a result of this crisis. And Frank, that's all I have for business assistance.
Thank you. Christy, anything you'd like to add?
No, just want to say that I think it's pretty incredible that we were able to get $222,000 in grants out as quickly as we did. We have 12 additional ones that are pending. And Lynn mentioned the reopening kits. We have distributed about 300 of those so far, just from the requests that have come in to us. We're going to continue to do so, but city staff's been incredible and the business community is very grateful. And so it's nice that we've been able to help them.
That's great. Thank you both.
Thank you, Mayor.
Thank you. Thank you very much. So we're wrapping up. So Commissioner Simmons, if you'd like to share anything, whether it's on this topic or something else you want to cover, it's okay by me.
The only thing I got to say about this topic is masks are not political. Take care of yourself, take care of your family, take care of your neighbors. Do this not just for yourselves, but for everyone around you. Shouldn't be a hard thing to ask. It shouldn't be something that's debated on media outlets. Just do your part, man, so we can get back to some form of normalcy in our lives. Y'all playing with my wedding right now. My wedding is scheduled for September 4th, and I just want to get through that one. So, yeah, just wear your mask, y'all. The business that I want to bring to you all today, since we are meeting, is I think maybe 2 workshops ago, we talked about the basketball courts at Cypress Park. I've been emailed by multiple members of the community, actual residents of the community. I've also just so happened to be at City Hall, and a group of 6 gentlemen actually kind of met me in the lobby. They didn't know if I was going to be there or not. They were just kind of there on a hope and a prayer, and I wound up talking with them for a while. And, you know, they let me know that they have actually tried their best over the years, you know, to police the basketball courts and try to make sure that there is no foolishness going on, because, you know, they all shared their stories with me, and many of them have been playing basketball there since they were teens and things like that. Kind of what you had mentioned before, Commissioner Vignola, how long you had played there. And some of them even mentioned that they were former students at JP Taravella when you were the principal there, Commissioner Sarah. So, you know, they did not know how to engage with government. You know, I know that we kind of assume that maybe, you know, not I'll say that we assume, but, you know, it's easier to assume that people know how to interact with their government when they have concerns and things like that. But there are a lot of people that don't. And so they weren't really aware of even how to voice their concerns to the city with regards to the basketball court. And I mean, in full transparency, I just told them to email all of us, you know, email us their concerns. You know, that wasn't me trying to, you know, ginny up support or, you know, stack whatever. I just, you know, they didn't know how to engage with government. And that's our job, is to help people understand how to engage with us. And so I don't think this situation is settled. I don't think this was the last time that we should talk about it. I think there are other options we really need to explore, because, yeah, you can simply say, oh, go to another park. I know that's the simple answer or things like that. But for people whose lives and they're just who they are as living within Coral Springs has been tied to those courts and to that park, I think we have a duty to go back and figure out how can we configure or move around something within that park to still allow a basketball court there. You know, if I pay taxes here, I want to go where I should be able to go, and I don't want to just hear, oh, well, you know what? Go to another park or go to this place or go somewhere like that. So I really think this commission and city staff, we need to really sit down and think of some more options and not just say, all right, take the courts out and put pickleball there. I think that park is big enough for us to look at some alternatives. So I'm asking the commission if we can ask city staff to kind of, or at least Parks and Rec, and get with Frank to look at some other options. That's just my request or my ask for you all here.
Sure. Thank you, Commissioner. Vice Mayor Carter, and then Commissioner Sarah.
Yes, thank you, Mr. Mayor. And with respect to Commissioner Simmons, I think he's right about educating the public and how they can speak to us. I've also had the same emails. And, you know, the city's 25 square miles. There are over 30 basketball courts in the city. And we need to be progressive as a city in our growth and answering the residents' needs. There's 2 pickleball courts. You go out there and there are lines to get on. So I don't really see where it's fair that we have 2 pickleball courts. We have a number of residents that want to play on them, but we have 30 basketball courts, and taking away 1 or 2 in Cypress Park, to me, it's a disparity. Now, and I don't feel like, you know, we're not answering the residents' needs, because we do have multiple choices for basketball courts. I get memories were made there and special moments were made there. I understand that. But when it's located next to a playground, and we have spent more than 5 years discussing with the players, please watch your language. We continue to get the complaints from the residents and the parents. And that's where the problem lies. We planted a gigantic, thick hedge, and you can see how big it is, trying to mitigate the noise, not the bouncing of a ball, but the language. And it's not working. And it's not just, this didn't just come up. This has been going on for 5 years or more. And it's just reached the point where, what is the best use for that facility or for that property? And when you see the lines for the pickleball courts in Riverside, and this is an option that would alleviate the language issue, make the parents happy. There are still 30 other basketball courts that they could play on in the city. I get that they're not happy and they want that one. And maybe there is someplace else in the park we can put a basketball court. But right next to that playground, I just don't see where that's a good option. I don't feel it's a good choice. So on that note, my other comment is educating, communicating. I think we do a good job. It's always an option to do a great job or a better job, even though I know we're doing, you know, well. Communicating with our businesses is critical. I think that in the way that code handles things, and Christie's department is doing a fabulous job, Lynn's job also doing a great job, but that communication helps alleviate the underlying fears that business have. And we, you know, it says that we are here for you. We will help you. We will educate you. We will help you with your clients. but we still need the public. We still need our residents to comply. We, support your local businesses, buy locally. I'm off to the store to go buy meat for the weekend, but just wear a mask. Please wear a mask so that we can get past this and we can get back to what would be normal. Thank you, Mr. Mayor.
Thank you, Vice Mayor. Commissioner Sarah.
No, well, Mr. Mayor, I'd like to respond to
Yeah,
some
that's
of
fine.
what Vice
No
Mayor
problem.
Carter said. If that's okay, Commissioner Sarah.
No problem.
So I've only been on the commission for about 2 years. So I wasn't a part of the previous 3 discussions when it comes to this basketball court. Also, in the last 5 years, we've had immense turnover within our city staff, all the way up to the top with the city manager. And so, there's been a lot of different directions and settings and things like that when it comes to what we're doing in the city. So I don't think that's necessarily fair to say that we've been trying over 5 years when we've had different directions come from different leaders throughout the last 5 years or so. That was mentioned. Also, no, I didn't say anything about removing the pickleball court. I think that the pickleball court is already going to go there. I think that ship has sailed. What I am asking about is looking at that park and configuring something where we can find another spot for a basketball court. It shouldn't be next to a playground. I don't know who idea was to do that however many years ago Cypress Park was created. What I'm asking for is us to look at that park and find another space for it. I'm not saying remove pickleball courts or anything like that. Like I said, I already know that ship has sailed. We can, life isn't fair. We can always say what's fair and what's not fair. But I think when you have residents, for instance, like when you have, and I guess maybe this is too extreme of an example, and I may get pushed back on this, but when people were, up in arms about the slightest mention of removing Betty Stradlin Park or turning it into something else, you had residents out there campaigning and lobbying us and showing up at meetings and things like that. To me, I kind of look at it as the same thing. It's just like, look, this is a part of their memories because that was something that was mentioned. This is a part of their life. This is where they like to play. And if they are tax-paying residents, they live here in Coral Springs, you shouldn't be able to just say, oh, okay, well, you know what? Go somewhere else. That's just not right.
Got you, Commissioner Simmons. Thank you, Commissioner Sarah, then Commissioner Vignola.
Thank you, Mayor. I too have been contacted by some former students of JP Terraville and some residents concerned about the loss of the basketball courts. I had a really productive conversation with Rob Hunter a couple weeks ago. Once I was initially contacted, I believe that Rob is working on a plan. I agree that this is a great and the best location for the football courts, especially with the playground in close proximity. Rob was able to give me a really good historical overview of the courts over the years. So I would ask Frank maybe that in the future, whether it's with a workshop or a commission meeting, where we can get an update on the progress of the potential of relocating a court or maybe putting a court somewhere at Cypress. So just wanted to share that information in the conversation that I am.
Thank you. Commissioner Vignola.
Yeah, Commissioner Simmons, I completely understand where you're coming from with this, and the residents are. The problem is with Cypress Park is there's no other place to put anything the size of basketball courts without removing another field or another amenity that somebody else then would be feeling the same way. The other issue is over there we have the leagues. So you have soccer plays there, travel soccer plays there, you have softball that plays out over there. So if you were to eliminate some of those fields, that would create some other issues there also. There is some opportunity, I think, over by Coral Glades High School at the sports complex, where the 4 basketball courts are over there just to the east across a little sidewalk from the basketball courts currently are. I think there'd be enough room to add a couple more courts there also. But I caution on, if we start moving things around anytime any group comes and says, all right, well, we should do this or we should do that, it's kind of tough. We lost, I think, 3, maybe 4 even tennis courts over at Mullins Park that I used to play tennis on when I was a kid that were converted to basketball courts because there was more of a need for basketball at that point. But I would be in favor of adding a couple more courts over at Sportsplex. That area by the basketball courts, there is plenty of parking that is shared with the school. So when the school's out, a lot of people go out over there and play basketball. It would be a more central location, almost like a little basketball, outdoor basketball complex. I think we have opportunity there for growth in basketball. But the basketball courts being located near the playground, I think makes this a little tough. And if you were to put basketball courts, like I said, anywhere else, I think you lose some other amenities that we get other residents from other programs that would be upset with us. So.
Go ahead, Vice Mayor. Thank you,
Okay,
Commissioner Vignola.
I don't know if Rob's on this call or not, but when you go over the bridge and you have those two soccer fields in the, I think it's two, maybe there's three soccer fields in the back, and you have the parking lot here on the left, and then you have the restrooms and then the rest of the fields. Way in the back, often I see them putting storage, mulch, there's like a retaining area or something over there way in the back of that parking lot. What about, because I've never seen that parking lot full, what about taking a piece of that section back there? And I don't know how much space you need for a basketball court, but there's lots of parking over on the other side. I think you'd still have enough parking there, but maybe that section over there in the back, we could look at that. And it's still at Cypress Park.
Frank, I saw your hand up. Go right ahead, Frank.
And Mayor, consistent with the direction I was given at the workshop, staff is working on a plan to bring to you. We do have a meeting coming up at the end of the month that will be unveiling the sports master plan, as well as some sports policies and some other things that has to do with parks. So we are currently working on this to bring an option back, because that was the direction at the workshop, was to find an alternative for those basketball courts.
I appreciate that. Go ahead, Commissioner Vignola, and then it'll be my turn.
Thank you. Just the Vice Mayor's point, that parking lot actually does fill up. There's 4 large soccer fields out over there, and in the evenings and sometimes on the weekends and things, those parking lots absolutely do fill up. And if you fill those parking lots up over there, the concern is then people would have to park all the way across the bridge and further away. When we start talking about bringing in tournaments and things to showcase the city and the parks and those types of things, we would create quite a bit of issues. But I've been there many times where the parking is pretty darn full. Majority of the time during the week, with practice and stuff in the evening, that does get full.
So Commissioner Simmons, I will be your third voice to say, yeah, if there's a way to have at least one full court basketball court there, let's look at it. If Commissioner Vignola is correct, then there may not be anything to look at, but you have your support for us to take a look at that. I coach my grandson over on those fields. It's been quite a joy there. No pun intended. And on the left of the parking lot, so I guess maybe that's headed north, maybe there's space there. I'm not sure. I'm thinking that that's emptiness over there, but who knows? But Josh, you have your third person to at least take a look. I look forward to the master plan. Very happy to have the dialogue about this. I'm gonna pivot just for a moment because I got a request from a resident while Jared's still here. Has the time in the hospital due to COVID decreased? I don't know if you know that, or Dr. Lai, at least here, or generally for Broward Health, if you've come in for COVID, since March 13, March 16, and here we are, July 1st, start of the new half of the year, is the time spent in the hospital due to COVID significantly less than when it was earlier in the pandemic?
I don't actually have those figures readily available. However, what I'll say is we've seen less patients in our ICU, which would typically have a longer length of stay, or less patients on ventilators, and a younger population. So my sense is that probably that statistic is down from that period of time because of those two variables right there.
Great. So, and I think those two variables are very important for us to share with the community. You still have a lot of people just extraordinarily scared. It's their right to, have their fear. One of the things, Commissioner Vignola, that you often talk about, which is what occurred to some of the men that met with Commissioner Simmons, is a negative surprise. If there's anything we can do to avoid negative surprises, that's great. And I think if we can share some of this positivity, some of this positive information, share how the hospital is safe, to enter into. So yeah, the numbers have increased, and at the same time, let's keep sharing how you can be safe. And everyone on the commission has stated today, wear a mask, wear a mask. You'll hear me share that when I close out later. So other commissioners, before we wrap up, Commissioner Vignola?
I'm good. Thank you, Mayor.
Great, thank you. Vice Mayor Carter?
Not sure if you had me down as a yes for trying to find another Cypress Park, but yes, I am. I'm definitely in favor of that.
Awesome.
All I have. And yes, wear a mask.
As would I be okay with taking a look at other
Great.
areas?
Okay, so unanimous. Wonderful. That's awesome. And thank you again, Commissioner Simmons, for bringing that up. Anything else to add, Commissioner Simmons?
No, not at this time.
Great. Thank you, Commissioner Sarah.
Just want to thank everyone for participating in this commission meeting that was called by our mayor, and stay safe.
Great. Thank you. One last remark from a resident. Carol Brzezinski had shared an email, and she's concerned, at least at the aquatic center, you know, and it's a concern expressed by many people many times. You know, what do? You see somebody not wearing a mask, and, you know, Commissioner Vignola, you know, feels comfortable sharing to wear the mask. I feel comfortable. You know, some of our residents, they'll say, you know, please put it on, and they're being kind about it, but the response they're getting is not kind and not compliant. What can we do?
Am I allowed to speak?
Sure, Rob.
Yep.
So,
Perfect.
we've been addressing that. We've been having a lot of those problems at the pool. We have all of our staff that have now signed that they've read the mask order and the policies that we put in place for the public. What I'd suggest to the public is for the public to contact the front desk and let them know that we have anybody who does not have their mask out and mask on or walking through the crowds without a mask on, and we will address that individual person or staff member appropriately. We actually had one that refused to put them on, and we're working with legal on exactly how we approach that situation that happened at the Cypress Pool this past week. So we are aware of this situation, and my advice to everybody is make sure you contact the front desk, and we will handle it for them.
Great. Thank you very much. So I just want to thank our team, thank our commission, our first responders, our local hospital, for all your collaboration, communication, for being calm, for, you know, getting educated and sharing education with us. The marketing department, you're doing a great job. Code compliance, tripling your efforts, and not always, you know, necessarily being thanked. You know, not easy to be there. Vice Mayor, you have your hand up. Do you want to share, or are you just relaxing?
Both, but I do have something I thought of. You know,
Go
I think
ahead, interrupt me.
people don't want to confront people about wearing a mask because they feel like, well, or even going and telling administration about that, because I think they feel like a tattletale. And you're not a tattletale. You are trying to save our community. You're trying to help. So feel comfortable in either nicely approaching someone and saying, hey, you know, could you put your mask on? It's for the best of all of us. And if you don't, then tell administration, because you're not a tattletale. You're trying to save us, and we appreciate your help. Thank you, Mr. Mayor.
Great message. So as your mayor, my greatest priority is to the safety, health, and well-being of you, our residents. From the mental stress that COVID-19 has caused, to the impact on our families, to the impact on local businesses, what we're going through in this global pandemic, it's unprecedented. What I know is this, is that we must listen to the public health experts. They are experts. Wearing a mask is supported by evidence. Wearing a mask is not a political declaration. This is not a political solution. It's not a political issue. It's a health issue. So I call this meeting today because I'm concerned about COVID-19, the aftermath, and our public safety, and making sure that we are all heard, we're all informed, that we can share without having to scare, and talk about numbers, get into the numbers, and look forward to a brighter future tomorrow, and look at what we're doing to keep you and keep each other safe. It is definitely something that takes a village, and we need everybody's cooperation, collaboration, and kindness. Your kindness will go a long way. So I'm not asking you, I am imploring you to engage in social distancing, and to wear your facial mask. I'm asking you to please be kind to one another, be patient, allow for some strong emotions, and do your best to get by it. We are definitely stronger in this together. So I thank you all for being here. Any final comments from anybody else? Frank, JJ, Commission.
I'm good, Mayor. Thank you.
Great.
Thank you, Mayor.
All right, everybody be safe. Have a great day. And thanks for making sure this meeting got scheduled, Frank. I appreciate it.
No problem.
Bye-bye, everyone.
Take care all.